Health officials are worrying Hurricane Matthew could contribute to the spread of the Zika virus. To the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, on how serious this threat could be. Dr. Fauci, thanks for joining us. It felt like we weren't hearing about Zika as much in the last few weeks, and maybe the threat was starting to fade away a little bit. Will it reemerge after this storm?
No, as a matter of fact, at least in the relatively short term, measured in the next few weeks, we're actually going to see the opposite effect, because when you have weather of this degree of ferocity with winds going up to 100+ miles an hour, what actually happens is that the mosquitoes, including the infected mosquitoes, get blown away, as does their larvae, as does the eggs. So for a period of time, even though there's more standing water around, which ultimately is a good breeding ground for the propagation of mosquito populations, at least in the short term, you're going to have a clearing out of the mosquitoes. So although it's a terrible tragedy when you see such destruction and suffering and death associated with hurricanes, the mosquitoes get blown out. So what we're hoping is that when you do have that lull, which we expect for the few weeks following the hurricane, that although there will be difficulty taking care of standing water, because if you have destruction of property in places where water can accumulate, you could conceivably have a resurgence of it. It's not going to happen right away. So hopefully that interruption of that chain of transmission will essentially get rid of the infected mosquitoes. The issue is there are still people in Florida, several hundreds of people, who have travel-related Zika, and the concern is that when the mosquitoes repopulate, we'll see a return to where we were before the hurricane. But the immediate effect of the hurricane in the short term is to actually get rid of the mosquitoes as opposed to help the mosquitoes.
But what about now that that these mosquitoes have been pushed around and maybe they're in different locations? It felt like there was an exact...
No, they're gone. They're gone. So they are blown out.
Okay, I got you.
They're done.
Okay. So now we just worry, you know, the pockets of water, the standing water, once that everything fades. But do you think we can get back to the same level? Because, again, it felt like it was contained and perhaps on the verge of being a non-story.
Well, we were still getting several cases a day that are being reported, maybe not occurring, but the reporting of several additional cases in Florida that are not travel-related, namely local transmission. It's now up to over 160. We want to see that go to 1 and then no cases per day. Hopefully, when the mosquitoes do return, that chain of transmission will have been broken, that we're going to see a dramatic decrease. We hope for that. I mean, obviously, you can't take anything for granted.
Sure.
You've got to continue the mosquito control efforts that are being implemented by the Department of Health of the state of Florida, together with the CDC as a partner in that. So hopefully we're going to see that and a turnaround, so that after, when things recover as we get into the month of November, that the combination of the relatively cooler weather and the fact that we got rid of the infected mosquitoes may be actually a good thing.
Well, let's hope so. Dr. Fauci, thank you very much for the work that you've done on this and sharing your thoughts with us right now. We appreciate it.
Good to be with you.